So this is Jody Tropeano, the Content Director for Health, and I'm here with Dr. William Winkenwerder, who is the Chairman of Citius Tech, and we're going to talk a little bit about the coronavirus pandemic. So thanks for joining us.
You're
Appreciate
welcome.
your time. So just to kick it off, it'd be great if you can share some of your background, specifically dealing with health emergencies.
Right. I'm a board certified internist trained in primary care internal medicine. And then following that training period, I went to business school at the Wharton Business School. And I also combined that at the same time with what was the equivalent of a master's degree in epidemiology and biostatistics. So from very early on, I had a real interest in looking at what we would now call today population-based health, outcomes, evidence-based medicine, and then that sort of led into an interest into informatics. But I combined all of that with an interest in leading healthcare organizations, and so really I had, beyond my early years in clinical practice, moved into becoming a medical director, chief medical officer, then a chief operating officer, CEO, and so forth. So I've really seen healthcare from the front lines all the way up to the most senior levels of executive management. And then in addition to that, I spent 2 stints working in government. The first was 2 years working for CMS, and a program that runs Medicare and Medicaid, where I served as an assistant to the administrator, the person who was the head of CMS at that time. And then about 15 years after that, came back and had a 6-year stint serving as the Assistant Secretary of Defense for Health Affairs. And that experience started right after 9/11. So it was a little bit like the situation we're in right now in terms of the country being traumatized. And 10 days after 9/11 is when I started my job at the Pentagon. And I stayed there for 6 years and dealt with just about every crisis imaginable, from the early days of concern about anthrax. There were attacks with a biological agent, anthrax, and it's very lethal, different sort of scenario than with COVID-19, but it had the whole country in quite a shock for a period of time. And then we began to worry about smallpox and other bioterror agents because of the terrorist threat. And that consumed a lot of my time early on. And so I came into work with the FDA, and with the CDC, and with all of those other agencies that we now hear from every day. And over the years, I've worked closely with many of the leaders who were there at that time, some of whom are there today. So Dr. Fauci, who's really a household name, is a good friend of mine. And we work together on a lot of these infectious disease and biological threat type issues. So he was a colleague. Dr. Burks was actually part of my organization at the Department of Defense at the time that I led everything there for the military health system. Alex Azar was a colleague and friend, and he is now the Secretary of HHS. He was the general counsel at that time. And there are many others. But so as I watch my former colleagues in there battling every day, my heart and mind is with them. And I know very difficult challenges that they face.
Yeah. So I guess we can get a little bit into that. So what do you think the high points have been in our fight against the spread so far? And what do you predict it will look like moving into phase 2 of this battle, if you will?
Yes. Great question. The high points this far from a positive standpoint, I think, are I go back to the spirit of the American people. People really have, just over the last 2 or 3 weeks, and I think we're going to see more of it, begin to mobilize the way that America, like no other country, can do. And we're beginning to see people coming together in lots of ways, and signs and symbols and real work and sacrifice. Uh, Probably the top of that list for me is my fellow uh, coworkers, colleagues, physicians, nurses, people on the front lines. They absolutely are putting their lives on the line every day when they go to work, and so I'm very proud of the entire um, the entire number of people out there that are doing that every day, and especially New York City
Yep.
is the world epicenter right now, but very tough.
Mhm.
And our hats are off to everybody, and our hearts are with them.
And what do you think it will look like moving into phase two? Will we see any stark differences from the plan so far?
I think we will. This first phase was one of absorbing the hit and beginning to understand what we're dealing with. This is not uh, an infectious agent that will be, a series of bad illnesses happening in thousands of people and then going away.
Hmm.
There was some hope for that, and I think people made statements. Some people made statements, leaders here, there, thinking, hoping that that's the way it would be, because we've had several things that have turned out that way. Other viruses, other novel viruses that came up and then pretty not mysteriously, but in ways that we don't understand, just went away. And many times viruses, especially respiratory viruses, go away during the warmer season. It looks like, based on everything I see and know, that this particular virus is not going to go away. It may uh, lessen its impact during the warm months, but it's most likely to be a seasonal virus that comes back again in the fall. I know I've heard Dr. Fauci and Dr. Burke say that, and I trust their judgment on that. So I think we have to think of this as, if you compare it with, like, for example, taking care of a patient. If the patient comes in with an acute illness or acute condition, you deal with a condition, you get them better, you send them home. If they're coming in with something that might be the manifestation of an acute condition, but they really have an underlying chronic condition, there's a different approach.
Yeah.
You have to follow them over time. You have to monitor what's going on, and you have to intervene in ways that can help them along the way. And I would make the analogy that with COVID-19, we've got a chronic condition, and we have to figure out how to manage it chronically over the months and years ahead.
Yep. That makes a lot of sense. And can you touch on a little bit the preparedness at both the state and federal levels, maybe focusing on the PPE equipment and
Yeah.
other supplies that the hospitals need?
Yes. Well, there was a national preparedness plan that was developed. Actually, there was probably a plan before my time there in the early 2000s, but I know we significantly updated that plan and put some real meat on the bones of that plan. It was a national preparedness plan for pandemics, and it was pulled together around the concern at that time about avian influenza, another virus, actually another virus that had originated in Asia. And we were concerned about a massive influenza epidemic like the 1918 epidemic, and we put together, when I say we, it was multi-agency across the government. So there was a plan then, and that plan has been updated. But beyond that particular plan, there are many things that were done in the past. So, for example, up until the time I was at the Department of Defense, 2001 to 2007, pretty much all these massive emergency preparedness things rested within the Department of Defense.
Mm-hmm.
We moved a lot of that capacity into the Department of Homeland Security and into the Department of Health and Human Services. In fact, whole new agencies were established in each of those departments. So there's an agency today called the Assistant Secretary for Preparedness and Response. That agency is the one that's working with FEMA
Mhm.
and with the U.S. Army and the Army Corps of Engineers to stand up the hospitals today in New York City. So all of that integrated preparedness is good. Did people in recent years or even back then anticipate an infectious agent that would spread as fast and as easily as this one and act in the way that the coronavirus is acting? Um, I think it was always in the back of people's minds,
Mhm.
but we'd never seen anything like what we're seeing today. This is a new virus, and it's sort of ripping through the population everywhere around the world. We just don't have immunity to it. And so it's hard to prepare for that, sort of extreme case.
Mhm.
The unfortunate thing is we got the extreme case. We got a virus that kills a certain small percent of people, but it spreads like the common cold virus. The coronavirus is a common cold virus. And, roughly 40, 50, 60% of people get a cold every winter, right?
Mhm.
So when you've got that mortality or that morbidity capacity inside of a coronavirus, that's a bad combination. So that's where we are. And we should be, as we are today, I think, calmly looking at the situation, figuring out what we need to do, how to get ahead of it. And that's maybe where we can talk more.
And how about where there's different curves in different regions? You touched on New York before, which obviously is seeing
Yes.
a lot of activity right now, but maybe that will slow and it'll hit some other cities down the road. How do you manage all of those happening at
Yes.
the time?
Well, you have to have a certain level of management and a policy and a perspective that is at the national level.
Mm.
But every um, local epidemic, and that's what we're seeing now, is local and regional. So they're going to occur at different times. They're going to affect maybe somewhat different groups of people.
Mhm.
Every local epidemic will be, its own, and it has to be addressed that way. So New York really wasn't the first. It was in Seattle, Washington, was
Yep.
really the first epicenter. Fortunately, it appears at this time that area is stabilizing in terms of rate of new infection. Doesn't mean they're not getting new infections. It's just the rate is stabilizing, and the deaths are stabilizing, or maybe even going down a bit. So that's a good news. But they've been battling this for 2.5 months.
Yep.
And then, of course, New York gets hit, and I think gets hit in ways that obviously this is a silent killer. So it was out and about before millions of people knew about it, right? So that's in New York, unlike few other areas in the country, is so dense, congested, lots of use of public transportation, lots of use of international flights and travel. It's the area of the United States that has the most sort of intermixing of people coming from all kinds of places. And
Mhm.
so it's not a surprise in many ways.
Yeah. That's where our health headquarters are. So we're watching very closely and all staying home, as you can see. Um,
Yes,
so you touched a little bit about the Army Corps of Engineers before. Can you shed a little bit more light on the military medical
yes,
response and what special capabilities that brings to battling a pandemic like this?
right. So that was one of the real highlights of my 6-year tenure, is working with the men and women who put up incredible capabilities on short notice in a mobile fashion or in a at a distant location. So the U.S. military is used to doing what we're doing today in New York City, and will be doing in other locations. going in and finding the resources that exist there locally and then putting up medical capacity really quickly. So we do that in wartime. That's how we care for people. And so they've thought through all the processes that you need to think through to set up the capability to care for people and do it, in a hygienic way, in a way that doesn't spread infection, and that allows people to do surgery, whatever it is. Most of the capability can be put together. So we did that, and certainly one example, one highlight during my tenure was we didn't have ways to take care of critically wounded that were on the front lines that were like in Iraq or Afghanistan. They need to come back to the United States. The U.S. Air Force medical component designed and redesigned the entire fuselage, the back end of a C-130, and created an intensive care unit.
Mm-hmm.
So it was an intensive care unit in the air. And that's the kind of sort of creativity, ingenuity, and capability that my former colleagues brought to bear. So we're capable of doing that kinds of thing, and I think you're going to see more examples of that. The hospital ships.
Mm-hmm.
I was involved in sailing the United States Naval ship Mercy. It's now on the West Coast,
Mm-hmm.
and we used that ship for an important mission to provide relief during the Asian tsunami. That was the terrible wave that hit Indonesia that killed, literally in a matter of hours, hundreds of thousands of people. So that area was absolutely devastated. And we wanted to help. The United States wanted to help. We put together that ship, created a mission. We actually used civilian medical personnel working with the military medical personnel to go over and do the surgeries and the care and so forth. That stayed there for like almost a couple of months and did thousands of procedures and surgeries and so forth. They're extremely well received and appreciated by the people there. So in the same way, the USNS Comfort, which is now in New York Harbor, will do that, providing relief. Not necessarily, they won't take care of the COVID-19 patients. They'll take care of the patients who couldn't get in to the hospitals because of the COVID-19 workload.
Yeah. It was definitely a sigh of relief for New Yorkers to see that ship today pull up.
Yeah. Did you get a chance to see it offline?
I'm on the east side, but maybe I'll, when I take my daily walk over there.
Yeah, it is quite a sight.
Mm-hmm.
It's a very inspiring thing to see the
Yeah.
big hospital ships.
Great. And so moving now, the information management supply chain, how do you feel it's been effective in battling this pandemic?
We're just beginning to tap what I believe is our ultimate resource against this virus,
Mm-hmm.
and that is information, data. And if you just consider this for a moment, imagine if every adult in the country knew right now what his or her COVID-19 status was. Were they positive? Were they negative? Or were they serologically positive? Had they been infected, but didn't have symptoms but have some immunity? Think what we could do with that knowledge. Every single person that was infected would know they needed to isolate. And they could prevent getting other people from being infected. People who had been serologically positive would have some sense that they had some immunity. That would be a good thing to know. But if you could separate out those that are at risk from those that are not at risk, you'd have a totally different approach to the isolation procedures and practices. You wouldn't need to necessarily isolate everybody because if people could aggregate that were safe, that'd be no problem. So getting to that point, I believe, is going to be a key step to getting everybody back to work.
Yep. Makes sense.
And we need to do that. So how would we do that? The only way we can do that at this point is by initiating a massive national testing campaign.
Mm-hmm.
And I'm just releasing an article that is just coming out this afternoon on LinkedIn,
Mm-hmm.
and we'll go into detail about that process. But basically, we are now have tested up to just over 1 million people as of yesterday. It will probably be 1.1 to 1.2 million today total test. That's a big step forward from what it was
Yeah.
2 weeks ago. But the reality is we need the capability to do tens of millions of tests in a single day.
Mm-hmm.
We need enough testing capacity so that everybody could get tested and then retested.
Yeah.
Because a negative test today is not necessarily what you need to know a week from now or 2 weeks from now, especially for healthcare workers, police, firemen, transportation workers. They're exposed, so they need to know that they're negative.
Yeah.
And but that capacity, the good news is we just approved, the FDA did last Friday, a testing device that is manufactured by Abbott Labs,
Mm-hmm.
and it is reportedly able to process as many as I think it's like 25,000 tests a day, or maybe 50,000. The devices themselves can produce a lot of tests. Of course, they're producing a lot of devices to distribute all over the country.
Yeah.
So that's good, and that would all be incremental to, and in addition to the current testing capacity. So, and the current testing capacity, if you just do the math,
Mm-hmm.
we about 100,000 tests a day increase every day, more that we're doing. So if you go over 30 days and just slightly increase that amount by a few percentage points a day, probably get up to like 3 or 4 million tests in the next month, combined with the Abbott testing device, which they say could do 5 million in a month. You're almost to 10 million people. So it actually begins to become realistic that we could do this huge amount of testing.
Yeah, I
So
saw the Abbott test and could get a
yeah,
positive in 5 minutes, which would be incredible.
incredibly helpful. I mean, you got to have the immediate information
Mm-hmm.
with the right information for every person to guide his or her actions.
Mm-hmm.
Then to have that information aggregated so that policymakers at the state or local level or federal level can adjust the guidance for what people should do is the key. So all of this goes along. It's almost like epidemiology and data and surveillance is a treatment tool in many ways, or it's certainly a prevention tool.
Mm-hmm.
And it goes alongside the treatment. There are others that are focusing on the treatment, which is great. And I practice medicine. I always like to, give the right medicines and all of it that was needed. But I got equally excited about things like this, data that would help people, that would prevent disease, and what people could do with good knowledge and information.
Yep. So we've covered a lot on the impacts from a health standpoint, but what do you think the major economic impacts will be
Yes,
when this is all said and done?
that is a great question. That's a tough question. Obviously, right now, it's just really hurting so many different sectors of the economy.
Mm-hmm.
It's hurting not just restaurants and bars, but certainly hotels, accommodations, transportation, anything associated with that transportation. So travel agencies, and you just go down the line. And then within the healthcare system, even though the healthcare system itself is very busy, and beginning to be more so in different parts of the country because of the coronavirus, what's happened is the routine um, procedures and surgeries and et cetera have been deferred and put off,
Yep.
which is the right thing to do medically, but it creates a very difficult situation economically because those are the bread and butter things that those institutions do
Mhm.
to generate most of their revenue. So if they stop doing those, I've heard of one example, I won't name the institution, but it's a well-known institution who's doing roughly a third of the normal bread and butter surgeries that really created all the profit margin for that institution. So even healthcare organizations, busy as they are being hit, many of them, in a negative way.
Mhm.
So the economic effect cascades in so many directions, it's hard to sort them all out. But the most important thing is having the solid public health and medical strategy that not only uh, prevents new infections and saves lives and reduces hospitalization and the like, but a strategy that gives people the knowledge and the confidence as to when it's safe to work.
Yep.
So these things go together, but I
Mhm.
think it's useful to really think about, uh, you know, how they're two separate things, but how they're intertwined. And
Mhm.
we have to do the public health part in order to get to an environment where people can go back to work in significant numbers.
And that was going to be my next question, actually, just, the shelter in place orders and other self
Yep.
quarantine orders that cities and states have right now. When do you predict they'll be eased even just a little bit?
Yeah. Boy, that's a $64 question as well. Dr. Scott Gottlieb, whose name is in the news just about every day, also a former colleague and someone whose views I respect and who I think is very smart. He has been out there publicly saying that he believes, at least I think he means it with respect to maybe Washington State and New York, that it will be reaching or may reach the peak before the end of this, say this month, before the end of April,
Hmm.
and that we could be on a downward, somewhat downward curve at that point. Um, I hope that's right,
Me too.
uh, but um, the caveats to that are number one, even if you're on a downward curve, it doesn't mean you can't stop doing things that
Mhm.
cause new infections to occur. And so that's still an ongoing challenge. And then the other thing is that the epidemics that are local in other areas are days to weeks behind New York.
Mhm.
So it's not all going to happen at the same time.
Mhm.
And uh, and then that kind of brings in challenges when it comes to transportation
Mhm.
because moving across state lines. So you're seeing that right now where there's concern. One state, if the people from another state, if there's a high incidence or a high prevalence of
Mhm.
infection of people from that state coming into another location. So again, I go back to my proposal. Uh, we really have to have massive testing and information about everyone's status, and with that, I do believe people could feel relatively confident, relatively comfortable about traveling and about moving about the country.
Hope so. And when you share that article, we'll be happy to share it on our health channels too, so everyone
Sure,
could read it. And
great.
yeah, this has been really informative, really wonderful. Thank you so much for taking the time.
You're welcome.
Any other last thoughts or words?
Well, I just would leave everyone with a thought that we will get through this, and I'm
Mhm.
very confident of that. American, we fight like cats and dogs, which is a little disappointing sometimes.
Yeah.
But I think we all value being Americans, and in our hearts want to do the right thing for each other.
Yeah.
And this is a time when we truly have to come, and we are coming together to care for our neighbor, our friend, our family member. And as long as we keep that sort of at the top of our thoughts, and we're smart about the actions that we should take, we'll work through this. We will get to a place where we have, I think, this great information, smart information base about the whole country. I do think we're going to get to treatments that work and come close to curing, or if not greatly mitigating the disease. I think that we're going to get to a vaccine that's safe and effective. It's just that we're in the throes of a very tough period right now. You just grind through it with the expectation that there are going to be casualties. So we just move forward.
Yes. So thank you so much again.
Thank you.
For your time. Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.